Hello, veterans. Welcome to another daily segment of the Veterans Nation, brought to you by veteransnetwork.net. We have Mike, Rick, and Rydell, myself, Kelly, and we have a lot of important information for you today.
Yes, we do. Shall we dedicate?
So today's show is dedicated to the 3rd Air Force. And Kelly, your Air Force?
Proud of it. The 3rd Air Force is responsible for all the United States Air Forces in Europe. They are stationed out of Ramstein, Germany, which I personally have been stationed at, briefly. Wish it was longer. It's a good place to be stationed at. Good outfit.
Yeah.
All right.
Great. All right.
Well, let's march. Let's continue on. We got a great show.
Let's do it.
Well, for you vets that live in remote areas and you would have a hard time getting to a VA health facility, we just got some helpful news from the VA that I'd like to share with you. The Department of Health and Human Services and the VA have announced a joint effort to expand healthcare delivery to veterans living in rural areas. The agreement between the two agencies promotes collaboration between VA facilities and private hospitals and clinics and is supported by $983,100 in grants to improve access and coordination of care through telehealth and health information exchanges in rural areas. This pilot program will spur collaborative networks and virtual linkages among rural health providers and the VA. If you need some information on this, their website is www.hrsa.gov, and since we're military, that's hotelromeosierraalpha.gov.
I like that. Good deal. Good deal. I know Congress and the VA and the White House Council have been all working real hard for quite some time to resolve that problem of rural vets and their transportation and getting to facilities and all that. And I think it's great. They won't have to travel hundreds of miles now. They can,
Yep.
Get it right
I'm from
here.
a small area, so that would be very helpful for like my parents.
Right. Good. Moving forward.
And this from the Army Times. 2 sweeping packages of veterans legislation received final votes recently, including provisions to create a burn pit registry to monitor the health of Iraq and Afghanistan veterans. Another bill to provide better consumer-related guidance on using the GI Bill and provide dignified burials for veterans who die with no money and no known next of kin. The latter bill, according to U.S. House Rep. Jeff Miller, demands better coordination between VA medical examiners to identify veterans who have no next of kin and ensures VA has authority to provide a casket or urn for any veteran. The Times pointed out that VA had opposed creating the burn pit registry, but lawmakers sided with veterans and veterans groups. Well, these reports are a great example of veterans raising noise and veterans organizations that stand up and contact their representatives to make a difference.
Well, on that, and we'll be right back with a special guest.
Okay.
As a U.S. Marine serving in Iraq, I was trained for combat.
From where I was sitting as a U.S. Army soldier, I knew I had to go where I was told, when I was told. From where my family was sitting, they knew I had to go too.
But nothing prepared me for coming home. History shows that while most service members physically return from war,
some never return emotionally.
Some never return emotionally.
The challenges of healing the visible wounds of war can be a daily struggle.
Many face a daily struggle to access the support they need.
But help is available through the National Veterans Foundation Lifeline.
A lifeline staffed by fellow veterans who've been there.
Dedicated to helping veterans and their families find solutions.
Time may not heal all wounds.
But from where I'm sitting today, I know the National Veterans Foundation can help.
The National Veterans Foundation can help.
For more information, call toll-free 1-888-777-4443 or go to our website, nvf.org.
Okay, and we're back here at Veterans Nation. I actually have a gentleman here who's going to be giving us some really great information. His name is Mr. Tom Gatto, and he is with Gatto Financial. He's here to tell us about private medical benefits that veterans may not be aware of that can actually go along with your current VA benefits. So Tom, welcome to Veterans Nation.
Thank you for having me. I appreciate it. And before I go on, I just want to thank all you veterans for everything you guys do and Appreciate that very much.
Thank you, Tom. Appreciate it. So you're based here in California, correct?
I'm in Southern California, and I'm a senior financial advisor. And in the scope of my work from day to day, I work with seniors on a regular basis. And it occurred to me over the last couple of years that a lot of the seniors that I run into are veterans. And because I deal with Medicare supplements, you know. Now, for those of you who don't know, or some of you do know, when you're eligible for Medicare, you reach 65 years old. If you put into Social Security, you're eligible for Medicare. Medicare gives you your hospitalization and medical doctors and other services. That's your Part A and Part B. And for those of you who don't know, it's that red, white, and blue card that you receive once you reach Medicare age. Once you have that, you're eligible to go to doctors who are Medicare, who accept Medicare. And for the most part, Medicare only pays for 80% of your medical services. The other 20% comes out of the patient's pocket. So when in the scope of my work, when I meet a vet and they go, hey, you know, I got the Medicare card, but I go to the VA because I don't have the 20% to pay for out of pocket. So I go there because I get my benefits all taken care of. And that's wonderful because you guys deserve to have that as vets. But what I do is I bring them information that says, look, you know, when you're 65 and you have a Medicare card, Part A and Part B, you are also eligible to sign up for a Medicare Advantage plan. And what that is, it takes the part of your Part A and Part B, and it goes into a specific insurance company. So now you sign up with a network. It's almost like an HMO of Medicare. And to make it for layman's terms. So you pick a doctor, you pick a dentist, and what it gives you is benefits far beyond that you can get from just going to the VA. Now, the VA gives great benefits, don't get me wrong, but in conjunction with hospital, doctor, prescriptions, you also get eye care, you also get dental, you also get vision. You get a 24-hour gym in some cases where you sign up for a gym 24, for 12 months. These are no cost. These are no premiums. Now, I'm here in Southern California. So in this state, Los Angeles County, Orange County, most of the southern counties of Southern California, there is no premium. There is no copay. So this is a home run. Instead of the vet having to go down to one of the local VA hospitals and stand in line, he can call up his own doctor and say, Doc, I'm not feeling good, I got a cold. Or, you know, hey, I need to go to a dentist, and he's part of that network. And it costs him no money out of pocket. Now, this is not for every insurance company out here in California, but some of the ones that I do represent give this benefit at no additional cost. So how wonderful is that the vet, instead of standing in line at the VA, can go to his own doctor and getting all these other things taken care of that he couldn't do before. Now, every state is different. Not all insurance companies that are in Southern California will be in the other 49 states. But I'd be glad to refer veterans from other states, say, hey, you know, you're in California, what could you do for me in Kentucky, Alabama, wherever? And I will provide them with a carrier or a contact in that state that might be able to do the same thing I do here with a program that they have in that particular state. But I think it's it's good information. That's why I want to get it out there, because I go to the VA, and I've been there, and I went to the DAV area, and I've gone to some of the other associations in there, and they think it's a wonderful idea. The Veterans Administration obviously cannot promote a private insurance carrier, but they think it's a wonderful idea. So this is why I was so happy and grateful that Rick has let me come over here to present this information to you guys.
That's really great information, and we really appreciate you sharing that and reaching out and helping vets understand that, and that's available.
It's my pleasure to do it.
So vets across the country essentially can reach out to you. Is that okay?
Yeah, I have an 800 number. I'd be glad to take calls from them, and I will refer them to somebody in their local state that provide the same kind of service that I do. And like I said, every state is different, so the programs we have here in California may differ from the ones in other states, but there's a very good chance that they're going to get a program identical to the one we have here.
Okay, great, Mr. Tom Gatto. We really appreciate you coming on board onto the show, onto Veterans Nation, and sharing that really valuable information. If you want to reach out to Tom, his number is, you can see it on the screen. It's
1-800-216-6414.
There it is. Thank you so much, Mr. Gatto. Appreciate it.
Thank you for your time. Thank you for letting me come on.
Thank you.
Thanks for tuning in. Had a great show today. We'll see you tomorrow.